Are you looking for a tooth implant alternative? Have you ever wondered if there's another way to restore your smile? Something less invasive, perhaps? Well, you're in the right place. Let's delve into how dentists save teeth with crown and filling. So, how does a crown save a tooth? Well, it all begins with your dentist preparing your damaged tooth. They'll reshape it, creating a sturdy base for the crown. Next, an impression of your tooth is taken to craft a custom-fit crown. The crown is then placed over the prepared tooth, acting as a protective cap. It shields the tooth from further decay and damage, while also restoring its shape and size. And just like that, a crown can bring your tooth back to function and aesthetics. But what about fillings? How do they come into play? Well, fillings are essentially the superheroes of dental restoration. When a tooth is damaged by decay, a dentist will remove the decayed tooth material, clean the affected area, and then fill the cleaned-out cavity with a filling material. This process restores the tooth to its normal function and shape. The filling also seals off any spaces where bacteria could enter, preventing further decay. So, a filling not only stops the decay but also prevents it from spreading further. To recap, a crown or filling can be a great alternative to a tooth implant. These methods effectively salvage teeth by restoring their structure and function. So next time you are faced with a dental dilemma, remember, there are alternatives. Your teeth have a chance at a second life.